is Gershon Volkman is going to give us results of treatment of simple and comminuted patellar fractures, a comparative study of different treatment modalities.
Thank you, Mr. Chairman. We know the treatment of patellar fracture is still controversial, and there are various surgical modalities that have been proposed, but there are only few studies that compare the results of these treatment modalities, especially if you try to correlate them to the degree of comminution of the fracture. Now we know that we can have two-part fracture, as one can see here, two-part fracture of this patella. Another example, but sometimes you can see three parts fracture of the patella, as one can see in the AP view or the lateral view. And even we can have comminution to few particles, as one can see here. As the problem, what to do? What is the best for this patient? To do a plaster, to leave it like this, to go and to do internal fixation by K-wire, tension wire, band, cerclage, etc., to go to hemipatelectomy, partial patelectomy, or to go to total patelectomy. So this is a series of 114 patients. You can see average age about 43, young 17 to 76, follow-up of 2 to 9 years, mean follow-up 3.5 years. It's a retrospective study, so we took out and looked about the treatment modalities of the patient. There was plaster tutor for 2 undisplaced parts in 12 patients, open reduction, internal fixation by cerclage, K-wire, tension wire band, etc., and even 1 or 2 cases with screws of 53 patients. This is the majority of them. Partial patelectomy in 37 and total patelectomy in 12 patients. We evaluate them during the follow-up with the functional score of Leesholm, objective knee society score, and of course by X-rays. And these were the results in 140 patients. Overall results, we can see functional results about 83%, excellent and good. Objective result, almost similar. But if you try to compare what are the results in the total group, you can see that in undisplaced fracture, you can treat them very nicely with a tutor, but this has to be for few weeks, 86% of succeed. And if you go between open reduction or hemipatelectomy in most of the patients, you can get similar results about success of 77 to 75. And this, for example, example of a patient with three parts fracture that were reduced by extension, and surprisingly, we got a nice articular cartilage alignment. So we did just few slices of CT, and amazing, you can see that the articular cartilage is looking very well aligned. So we told the patient, you can choose. We can do internal fixation, we can do a plaster. And the patient said, no, I don't want a plaster, and there are excellent results. So we decided to correlate between the treatment modalities to the degree of the patellar comminution. In 2 fragments fracture, we got similar results between the different operations, and we can see some samples of 2-part fracture with excellent result. 3 years later, you can see fixation by tension wire band, meta cerclage, and 2 Kirschner wire with beautiful alignment of the fracture, 3 years post-operation. And we can see that there are almost the same results following non-significant difference, similar result between the operation in this case. Another example of 2-part fracture, 4 years post-operation, you can see beautiful alignment with excellent result. But sometimes you may have failure. For example, in this case, this was the preoperative 2 parts. Maybe there is a beginning of another crack in this superior part that was fixed by Kirschner wire and tension wire band. You see that the compression is not so good. And although the Kirschner usually have to be in the anterior third, they are in the middle. And unfortunately, when we took out the plaster after 3 weeks, within few weeks, started complaining of pain. You can see the red displacement and avulsion of all the material outside with break of the loop. So we had to do a ray done again. Now with 2 cerclage, 1 circle and the other one is tension wire band, with very good alignment and compression of the fracture, that the patient was very unhappy, miserable, and then he said, I can't bear anymore. So we did a total patelectomy for 1 month, and now he's happy with the patelectomy. So sometimes even with 2 parts, you can have failure, especially if you're not doing well the technique. Now what happened with 3 fragments fractures? you see that there is some better results following partial patellectomy, but still not significant, this 85 to 80%. And these are some samples of three-part fracture fixed by cerclage, attached one bed. Usually you do double loop, 2 loops of metal in these cases. And this patient has fair result. You see some not anatomical alignment of the articular cartilage, and she is not happy with the result. What happened with 3 and more fragments? We showed a significant better result after partial patellectomy when we took out the different fragments and did a reconstruction of the tendon. And you can see here a patient with 3 parts fractures treated by cerclage and tension band and some Kirchner, but he has surprisingly a very good result. This is after 3 months, full alignment and almost full flexion. Other people, we did the patellectomy, as one can see here, reconstruction of the tendon, excellent result following 3 years. So with more than 3 fragments, we found that the best results significantly are with partial patellectomy than with open reduction internal fixation. Total patellectomy also can lead to the same, but why to do it? Because total patellectomy, the patient complains usually about feeling of, it's weak, the knee is weak. So we prefer to go to do the partial patellectomy, of course. And this is another example of excellent result following 3 parts using the double loop, as one can see here, with beautiful alignment of the articular cartilage. But on the whole, the better result after the partial patellectomy. We serve the total patellectomy as optional treatment only with comminuted of many parts. As can be seen here, you see a few parts in the inferior part, and here also 2. This patellectomy, the plaster is for 6 weeks, and then you start physiotherapy. So according to this study, we can say that the diagnosis depends primarily about the degree of the chondral damage sustained at the time of injury and the quality of the articular restoration. Any intra-articular incongruities leads to post-traumatic arthritis and bad result, and therefore we think that the open reduction internal fixation should be considered as the first optional treatment in simple patellar fractures of 2 and 3 fragments. And again, some samples of it with a good result. Partial patellectomy will be the first optional treatment, in our opinion, in patellar fracture with 3 or more fragments. You see the 3 can be in both sides because we got more or less the similar. It depends what you prefer and how you can do the restoration. And I'm sorry that the lecture about arthroscopic assisted didn't arrive, because if you do arthroscopic evaluation, you can see exactly what happened there in the articular cartilage before and after your operation. And total patellectomy, we would recommend to keep it only for patients with comminuted fractures. Thank you very much.